Scoliosis is seen or can be diagnosed at birth only. Girls are usually more affected than boys. Hi, scoliosis in simple terms means bent spine. Cause of scoliosis is usually hereditary or developmental defects. The symptoms of scoliosis is usually cosmetic, and in some cases it can also cause weakness of the lower limbs more commonly than the upper limbs. It is also associated with various other disorders like deformities of the hips, knees, ankles and foot. Usually, scoliosis is seen or can be diagnosed at birth only, but in certain cases where the scoliosis at birth is minimal, it becomes apparent by 5 or 6 years of age. Girls are usually more affected than boys. Scoliosis definitely changes with age. As the height grows, the spine can become either more bent, or in certain cases the deformity will persist or not change too much. It usually depends at what part of the spine the scoliosis is most prominent. For example, the dorsal spine or the mid-back is the most common level of scoliosis. It also depends on how many curves are present in the spine. Usually, 1 or 2 mild curves are well accepted by the patient. In other cases, where the curvature of the spine is more than 3 places or the angle of the deformity is very high, it can require surgery. It is a complex surgery in which the spine is set straight with the help of screws and rods along the entire length of the deformity, and is usually done in growing years only. The indication of surgery is sometimes cosmetic, but more of neurological symptoms also. If you know someone who is suffering from scoliosis, do not hesitate to get in touch with your orthopedic surgeon or your spine specialist to know whether this requires treatment or not. As this is Scoliosis month, I hope I was able to raise some awareness about this complex yet treatable disorder. For more information like this, like, follow and subscribe. Thank you.